If you've followed my work, you know that I consider omega-3 fish oil to be an indispensable part of my daily regimen, and that I've recommended it for my patients and followers for decades. If you're already taking omega-3s, you should know that I've discovered a product so special that it's become my go-to brand. Dr. Jeffrey Bland, one of the luminaries in the world of complementary health, takes omega-3s to a new level. Omega-3 Rejuvenate from Big Bold Health is a premium blend of pure oils from wild-caught Alaskan cod and sockeye salmon, sourced from the pristine waters of Alaska. Unlike most other brands, Omega-3 Rejuvenate does it differently. The product comes straight from the sea into the hands of skilled fishermen, instantly flash frozen, and taken to their specially designed shoreside plant using a low-heat technique to extract the pure amber omega oil that contains all natural and abundant full-spectrum omega-3s, including EPA, DHA, as well as DPA, plus all natural vitamins A and D, and naturally occurring pro-resolving mediators to support cardiovascular, cognitive, and immune health. Their unique process preserves the natural goodness of the fish, so you get maximum benefits in every soft gel. No fillers, no shortcuts, just pure, potent wellness. Visit bigboldhealth.com/Hoffman and experience the difference. That's bigboldhealth.com/Hoffman for Omega-3 Rejuvenate. Use coupon code Hoffman for 20% off site-wide. Welcome to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman. Today we're going to talk about metabolic health. There is an organization called the Coalition for Metabolic Health. Sounds good? I'm for it. But we're going to find out what it is they do. And with me today is the medical director of the Coalition for Metabolic Health, Dr. Bret Scher. And what came to the reason that I've invited him on today's podcast is because I read a statement by the Coalition for Metabolic Health that was strongly critical of what has been termed the Eat Lancet Commission report. The Lancet, one of the world's leading medical journals, came out with a report that advocated for a very low-fat, plant-based diet with kind of draconian restrictions on the amount of meat that we're supposed to be allocated. It would involve some degree of radical change in our eating patterns, but it is said that that's the only way that we can achieve sustainability and achieve planetary health. And besides, all that fat and meat is bad for us. That's essentially the position of one of the world's leading medical journals in their Eat Lancet report. So in the past, I've written some articles that are critical of the Eat Lancet report. And today we're going to talk to Dr. Bret Scher, medical director of the Coalition for Metabolic Health, who has also issued a very critical statement about the Eat Lancet report. And so welcome, Dr. Scher. It's a pleasure having you on Intelligent Medicine. Thanks for allocating the time to talk to us.
It's my pleasure, Dr. Hoffman. Thank you for having me on.
Well, first of all, tell us what the Coalition for Metabolic Health is.
Yeah. Well, thank you for the opportunity. The Coalition is a group of experts, clinicians, researchers, philanthropists, with the goal of making metabolic health the foundation of medicine. We realize that this country, the health of this country, and really globally has gone the wrong direction when it comes to metabolic health. And, I'm sure we've seen all the graphs of rising obesity, rising type 2 diabetes, and the recent report that said, 93% of Americans have suboptimal metabolic health. And this is despite well-meaning doctors and dietitians and medical organizations and government dietary guidelines aiming to do the opposite, aiming to make us healthier. Yet under that watchful eye, our health has only deteriorated. And, the experts at the Coalition really believe that is because of a misunderstanding and a sort of incorrect emphasis on metabolic health, that we really need to make metabolic health front and center, and not rely so much on dogma, on status quo, on on what has been done, but rather what actually moves the needle and what actually is going to improve the metabolic health of this country.
So what constitutes metabolic health? That's
Yeah,
it's a catchy term, but
yeah.
when we read a statistic that the vast majority of us, like 97% of Americans, is sometimes the figure that's quoted, are not metabolically healthy. It sounds like the 3% should be in the Smithsonian Museum, on display, because they're like rare, nearly extinct species.
Yeah. And actually, how simple that question is and how complicated the answer is might be part of the problem.
Okay.
That if you're talking about LDL cholesterol, it's one thing. You can see it,
Mm-hmm.
right? You can see it move. Metabolic health is not one thing. I mean, in essence, it's basically how we take in food and nutrients and oxygen and transform it into energy. How efficiently do we do that? Again, a very simple statement, but with so many different pieces. The way we can measure it is by glucose levels, insulin levels, triglyceride, HDL, blood pressure, what is our body composition, what is our waist size. So it's a number of different things that reflect how well or how poorly we are doing that, taking in nutrients and transforming it into energy. Do we do it efficiently, or do we do it inefficiently and store a lot of the excess nutrients, which then harms our ability to further transform those nutrients into energy. So that's part of the problem, right? Because just taking this time to explain it, it's a little bit harder to grasp. But when we're experiencing metabolic dysfunction, we really are having higher insulin levels, higher blood sugar, higher blood pressure, poor body composition, and then other markers in our blood lipids, triglycerides go up. So all of this sort of shows we're on the wrong path. So those studies that say 93% of Americans are metabolically unhealthy, that means that only 7% have all of those markers being optimal, and 93% have at least one or more that are suboptimal. So it really is kind of daunting. Why don't more people have better metabolic health? And one reason certainly could be because we just haven't prioritized it. And that's one thing that the coalition really wants to change, to make metabolic health the foundation of medicine.
And what evidence is there that metabolic health is a determinant in the outcome of many diseases, that it is central to the origins of many of the conditions that are now categorized as what are called non-communicable diseases? Because we in the past we used to die of tuberculosis and smallpox, and we're actually conquering malaria. We're conquering these diseases, but there's a terrible toll of what are called chronic degenerative diseases that not only curtail our longevity, but also interfere with our optimal health span.
Yeah. Well, there are a number of different lines of evidence pointing to this. And I mean, one just glaring example is type 2 diabetes, which really is sort of the poster child for poor metabolic health. Because in type 2 diabetes, your ability to take in nutrients, transform it to energy has been so diseased and so dysfunctional that now your blood sugar is really out of control. Your pancreas can't keep up, right? And you need medications to control it, although really it should be lifestyle interventions to control it. But what the evidence shows is people with type 2 diabetes are much more likely to have heart attacks, to have strokes, to require amputations, to develop cancer, to develop psychiatric illnesses, to develop a whole constellation of clinical dysfunction and clinical illnesses that are related to, in some way, the metabolic dysfunction. And even lower than type 2 diabetes, just the term insulin resistance, which can be measured in many different ways, that also is related to an increased incidence in all these diseases. So we definitely have the associational data. And interestingly, when we look at treatments for type 2 diabetes, if we're simply treating the blood sugar by giving insulin, by giving medications that can raise insulin, you can improve the blood sugar, but you're actually not improving the risk of heart attacks.
Yep.
You're not necessarily improving survival, which surprised a lot of us back in the day when that data first came out. But now we're sort of learning, well, actually, if you address the insulin resistance, the underlying cause of the disease, the insulin resistance, either with medications like SGLT2 inhibitors that lower the insulin, or with lifestyle interventions that can lower the insulin, that's where you're going to have the biggest effect, not simply by putting a Band-Aid on it by lowering the blood sugar. So we have a couple different lines of evidence showing the increased likelihood for a number of different diseases with insulin resistance and metabolic dysfunction. And we have the evidence showing a reduction in those complications by treating that insulin resistance.
And you are a coalition. It's in your name. You're the Coalition for Metabolic Health. So actually, I was referred to you by Dr. Martin Picard, who I interviewed on the subject of the mitochondria, who is one of the leading researchers on the mitochondria and has a very global view of how energy has to do with our well-being. And he has cast his lot with the Coalition for Metabolic Health. So who else is on that coalition that we might be familiar with?
Isn't Martin great? He's so wonderful to talk to and so thoughtful about mitochondria. So at the Coalition, we are a group of scientists and researchers like Dr. Martin Picard, Dr. Andrew Kutnick, Dr. Jeff Volek, and we're Dr. Dom D'Agostino, and we're also have clinicians, Dr. David Ludwig, who's a clinician and researcher,
pediatrician.
Myself,
He's a pediatrician, I believe, and so catching
pediatric endocrinology. Yeah, he's a pediatric endocrinologist. Yeah.
So his concern is, we really must catch this early because we're seeing such a stark increase in the incidence of obesity and even what was unheard of, type 2 diabetes among children and adolescents. Right.
And we have Dr. Andrea Salcedo, who is a OBGYN. So she really focuses on metabolic health as it affects women's health. Dr. Karen Jerome Zapaka, who is a GI doctor, gastroenterologist, who really focuses on fatty liver and that impact of metabolic health there. So really and so many more. I will take half an hour to name everybody, but it's just this really the experts in the field of metabolic health in their specific fields, whether it's a GI or endocrinology or primary care or cardiology, or a researcher in that field, or philanthropists trying to raise money to make metabolic health a priority, and also people helping with the policy of it. This is a unique opportunity where we are to really have an influence on the policy spectrum to make metabolic health a priority from that aspect as well.
And speaking of policy, they've just issued new dietary guidelines. Are you pleased with the inversion of the pyramid? They basically flipped the script on 6 to 11 carbohydrates at the base of the pyramid.
Yeah. So interesting when we started with the discussion about Eat Lancet and compare that to the new dietary guidelines, and they're, you could kind of say they're polar opposites. And yes, I'm very pleased with it, and very pleased that at the Coalition we've been talking about this from day one, how the dietary guidelines have to change and have to be more inclusive of the population we're dealing with, right? Again, if you start with the concept that we know the best way for everybody to eat, you're just starting from a flawed perspective. The whole thing is going to be flawed from there on out because we don't know the best way for everybody to eat. And that's why I'm so thankful that there is that segment in the dietary guidelines that says some people with certain metabolic disorders will likely benefit from specific diets, such as a lower carbohydrate approach, which is so important to have in there. Doesn't mean everybody needs to, but for that population, absolutely. And just the spectrum of foods that are now, considered allowable, if you want to use that word, or healthy, is really widened to be whole foods, plant and animal whole foods, which is absolutely consistent with good metabolic health, and reducing the grains, certainly the refined grains, certainly the added sugars, and even the quote unquote healthy whole grains, right? Reducing those so they're not given this health halo to eat as much as you want, because for someone who has metabolic dysfunction, that often does not end well. So yeah, I'm very thankful for these new guidelines. and the renewed focus they give on whole foods coming from plants and animals and the importance of metabolic health.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Kyolic aged garlic extract is considered by many to be the GOAT of garlic, the greatest garlic supplement of all time. For over 50 years, Kyolic aged garlic extract has been the trusted choice for millions for safe, effective cardiovascular and immune support. Aged garlic extract's effectiveness is well documented in over 900 published scientific papers and studies. Kyolic aged garlic extract is created by aging organically grown garlic for up to 20 months. This unique aging process makes aged garlic extract gentle on the stomach, eliminates the offensive garlic odor and taste, and results in safe, beneficial compounds found only in Kyolic aged garlic extract products. Whether you're seeking ways to maintain healthy cholesterol or blood pressure levels, or strengthen your immunity, there is a Kyolic formula right for you. Visit Kyolic.com and learn about Kyolic's many health benefits. That's KYOLIC.com. Look for Kyolic at natural health stores nationwide and online.
Thanks for listening, and thanks for supporting our sponsors because they are what make intelligent medicine a continuing free resource to you. And now back to today's guest, Dr. Bret Scher, the medical director of the Coalition for Metabolic Health. Well, some of our listeners may be asking themselves, am I metabolically healthy? So what are some of the hallmarks of metabolic health or lack thereof, in terms of, physical exam findings or blood test results, simple things that people can use to say, maybe I need to get on the stick and go to the website for the Coalition for Metabolic Health and find out a little more about what they're doing.
Yeah, well, the easiest one that you don't need a blood test, you don't need a doctor is a waist to height ratio.
Okay.
So you measure your waist, measure your height, and if it's 0.5 is sort of the tipping point. If you're below 0.5, that's generally a sign that you're metabolically healthy, and if you're above 0.5, that's generally a sign that you are less metabolically healthy. It's obviously a blunt tool, so it's not going to be perfect, but it's one that doesn't require any intervention. Now, simple blood tests can also be very helpful. We tend to rely a little too much on the fasting blood sugar test, but what's even better is a fasting blood sugar with a fasting insulin level, which is a simple test to get. You can combine the two and get what's called a HOMA-IR, HOMAIR. And you can, if your doctor doesn't know about it, you can just go online. There's a calculator.
Yeah, you just plug in the numbers.
You just plug in your numbers and it spits it out. But that is basically telling you how much insulin is your body requiring to keep your blood sugar at a certain level, which is a very good marker of metabolic health. Another simple thing, everybody gets a lipid test, but they always focus on the LDL. But if instead you focus on the triglyceride to HDL ratio, that's a very good marker of metabolic health. Less than 1 being ideal, less than 1.5 being very good, and on up from there. So those are some simple tests you can do. Also blood pressure can be a marker of that, of metabolic health. And there are more, but those are sort of like the simple ways to get started with giving you an idea.
Maybe get a CGM, try it out for a month. That could also be helpful.
I am such a fan of CGMs. They are so educational.
Continuous glucose monitors, yeah.
Correct. Yeah, thank you for clarifying. It really baffles me that this is controversial, that using a CGM to learn how your body responds to food should not be controversial. But again, it almost reflects the concept of, well, we know what's healthy food, so why would you need a CGM to tell you that? But the data is exactly the opposite. The data shows you take two people, give them the exact same food, and you can see two very different blood sugar responses. Now, I can see the point where if you're saying I want a flat CGM, meaning no blood sugar excursions, and that is the only healthy blood sugar, okay, that is a bit extreme. It is normal to have some blood sugar excursions. But what we're seeing is people are having, up to 180, 200 milligrams per deciliter that stays elevated for a couple of hours after having oatmeal, which is supposed to be healthy. No way. That is a very dangerous response. You want to see it, in the up to 120, maybe 140 at most, but then come right back down and not stay elevated for very long. That's how you can see you're having a healthy response to the food you're eating.
Yeah, we want the Berkshires or the Alleghenies and not the Rocky Mountains when it comes to our blood sugar excursions.
I hadn't heard that analogy. I like that.
Yeah.
I like that.
So good stuff. So let's tackle the Lancet report. Look, Lancet, very influential medical journal, perhaps one of the oldest medical journals around, international medical journal. I believe it is UK based, but it's read by doctors all over the world, highly influential. What's wrong with their recommendations that we adopt a plant-based diet?
Yeah, well, again, it goes back to what I said before. If you're starting for the assumption that we know the one diet for everybody, then everything that follows is just incorrect, because we don't. There is not one diet for everybody, and there are a number of reasons for that, some of which I just mentioned about how people have different blood sugar responses to the exact same food. But to know that would require an extremely high level of scientific evidence. And when we come to nutrition science, unfortunately, we're dealing with predominantly nutrition epidemiology studies, which are very low level of evidence. And that's not judgmental. That's just by definition, they are a low level of evidence that really cannot really relate to an individual with any strength. I'm happy to talk in more detail, but that's just sort of accepted it should be accepted, but unfortunately is ignored because it's just poor science. And I guess, another part of food, which is not quite science related, but we're not talking about taking a pill. We're talking about food, which is something we encounter every day, which has history, which has emotion, which has cravings, which has likes and dislikes. And that's not the same for everybody. So even if we knew this was the one way to eat, which we don't, it doesn't mean it's going to work for everybody. And we have to acknowledge that, because we are all different culturally and historically and in our likes and dislikes. We also have to understand that what the goal of healthy eating, in my mind, is to improve your metabolic health. And I don't think that's what Eat Lancet is talking about. I mean, they really are focusing on these nutrition epidemiology studies, which frequently focus on LDL or might focus on very small changes in health outcomes, but usually not specifically metabolic health focused. So I think that's an error. And there are many, many more. I guess I should probably take a break to have you respond, but I could get into many other issues with this diet.
Yeah, I'll prompt you, because this is actually something that you've written yourself, which is that they've actually done some studies of the nutritional profile of their recommended diet. And I don't recall what servings of meat were allowed on the diet, but it was almost like, a silver dollar sized, portion of meat a couple of times a week. And as a result, these diets may be critically short of certain nutrients like B12, iron, iodine, calcium.
Mm-hmm. Yeah, they acknowledge it themselves, which I found very interesting. They acknowledge that it is nutritionally insufficient. That's absolutely true. And if you're in an industrialized world where you can easily supplement, okay, you can say you can just supplement, although I would argue it's always better to get your nutrients from whole foods and supplements. But around the world, and this is supposed to be a global diet, around the world where they can't easily supplement, they are going to be in big trouble with a nutritionally insufficient diet. And they also acknowledge this really isn't sufficient for like growing teenagers and for pregnant women or for the elderly. There's a whole group of people who would be at even higher risk because of a nutritionally insufficient diet. So that's a problem. I mean, why would you possibly recommend a nutritionally insufficient diet? And when you think about sort of I guess you could say the bang for the buck, or, how much protein and nutrition per calorie that you get from animal products, animal meat, it is unmatched.
Yeah.
And for, a country that is overweight and obese beyond what we've ever seen before, getting the most nutrition for the least amount of calories should be what we're focusing on. That should be a huge focus. And that comes from animal foods, no questions asked.
Yeah, there's a theory that appetite to some extent is governed by our quest to eat adequate protein. And if there's scant protein in our diet, we simply eat more and more and more of low protein foods. in order to garner the protein. So in essence, we get fat because we get excess carbohydrates from these, from sources like, if you're going to eat brown rice and seaweed to, achieve your protein goals, you're going to have to eat a lot of that.
Absolutely. Absolutely. And I guess, to reflect back on the dietary guidelines, I really like how they are prioritizing protein and no longer using that 0.8 grams per kilogram of the RDA, which was basically just to make sure we weren't becoming protein deficient, but that had said nothing about sort of optimal protein levels for satiety, for feeling full, for maintaining our lean mass, for improving our metabolic health. So protein absolutely from whole food sources is crucial for our health, for our metabolic health, and for being satisfied with our diet. So to try and minimize that in a diet for everybody for the world makes zero sense to me.
Yeah, one of the main points of the Eat Lancet report is that for the health of the planet, for sustainability, it's a big word, for pushing back against climate change. We need to reduce our carbon footprint in terms of animal husbandry and resort more to plant foods. Now, my take on that argument is that it's kind of disingenuous because it's conflating two things. On the one hand, we're talking about what's optimal for humans to consume. And then we're saying, well, even if it's not that optimal, it's still good for the planet. So, that's why we're pushing people in that direction, because we want to issue a directive to the world that we need to raise less meat and devastate the Amazon less, to turn it into grazing for livestock, et cetera, et cetera.
Yeah. So again, this is so interesting. In the Eat Lancet report itself, so I'm going to read a quote directly from the glossary of the publication. And it says, the planetary health diet is based entirely on the direct effects of different diets on human health, not on environmental criteria. The diet's name arose from the evidence suggesting that its adoption would reduce the environmental impacts and nutritional deficiencies of most diets. So they're saying that it is based entirely on the direct effects of the different diets on human health, not on environmental criteria. So really, the whole environmental part of it is like really clever marketing, I think. If we're talking about the science of nutrition and human health being low quality and difficult to really wrap your head around and apply to an individual, it's even worse for the environment because, factoring in the type of livestock, the type of grazing, the lifespan of it, and trying to equate that to the same for these monocropping of corn, wheat, and soy, and what they do to the land and to the soil, and then the amount of land that is used for grazing that couldn't be used for anything else, and trying to factor all that in, and how much water is used from rain versus water that we actually have to come up with, not just by nature. All these factors are very challenging to come up with. And so I sort of agree with you that it doesn't make sense to try and do both. We need to find what is the healthiest diet for each individual to eat. And from there, trying to figure out how to do that sustainably. So do we start to transition more to regenerative farming to get away from, factory farming? Well, when it comes to cattle live on grass for the majority of their lives. We see them in these feedlots. That's just the end of their lives. The majority of lives, they are on grass. So I think it's very oversimplified, and maybe the more we can transition to them staying on grass and doing it in a regenerative way, we can actually have an impact on climate change. Whereas with plants and monocropping, that's not going to help anybody. That's only worsening the environment. So I'm not an environmental scientist, but the ones I've talked to, I'm sort of mirroring what they have said, and it certainly makes sense. But the overall point is, if we're focusing on human health, we're starting from the wrong diet to begin with. And to say that there's one diet just does not make sense. So it's just a failed concept from the beginning.
Great. On that note, let's pause because, as our listeners know, we divide our podcast into two parts. And in part two, we'll talk more about the application of a metabolically healthy diet to a variety of health conditions some of the work that's being undertaken by the Coalition for Metabolic Health. Our guest is Dr. Bret Scher. He's medical director of the Coalition for Metabolic Health. And you got a website at coalitionformetabolichealth.org?
Org.
Okay,
.org.
makes sense.
Yeah.
All right, good stuff. And then you can read up on all their initiatives. I'm Dr. Ronald Hoffman. We'll be back with more. This is the Intelligent Medicine Podcast.